Welcome to our deep dive, and today we're going to be tackling diabetes. We're going to be looking at understanding it and the tools available to manage it.
It's a huge topic.
It is a really big topic. We've got some great resources with us today. We're looking at information from the American Diabetes Association and the National Institute of Diabetes and Digestive and Kidney Diseases.
The NIDDK.
Yeah. And we'll be talking about the Sugar Notes app a little bit later, a tool we've been developing that we think can help make a real difference. But first, did you know? Over 530 million people worldwide are living with diabetes.
Wow, that's a lot.
It's a huge number.
It is. It really shows how important awareness is and finding effective management strategies.
And that's exactly what we're diving into today. So whether you're personally trying to navigate diabetes
Right.
or you just want to understand it better, we're here to help. So before we get into specifics, we often hear about different types of diabetes, right? Our sources don't specifically detail those different types. But I think it's important to acknowledge that management approaches can vary.
Yeah, that's a great point. You're right. There are distinct types of diabetes, and each one has its own little quirks and ways to manage it. While we're focusing on information that's relevant to all types today, it's important to remember that personalized care is really key. Always consult with your healthcare provider for guidance. That's tailored to your specific situation.
Absolutely, personalized care is paramount. Now let's talk about some of the factors that can increase the risk of developing type 2 diabetes. The NIDDK highlights several key ones.
Yeah, and some of them might surprise you, like being overweight or obese, having a family history of diabetes, and age. Specifically, 35 and older are well known. But did you know certain ethnicities are disproportionately affected?
I did not know that.
Yeah.
Which ethnicities are we talking about?
African Americans, American Indians, Asian Americans, Hispanic or Latinos, and Pacific Islanders are statistically more likely to develop type 2 diabetes. It's not just genetics at play. Socioeconomic factors and access to healthcare also play a significant role.
Yeah, that makes a lot of sense. It's crucial to consider the broader context of health disparities there. Now, the NEDDK also mentions prediabetes as a significant risk factor. So this is a condition where blood sugar levels are higher than normal, but not yet high enough for a type 2 diabetes diagnosis.
Right, and it often flies under the radar. It's a really critical stage where intervention and lifestyle changes can potentially prevent progression to type 2 diabetes.
Yeah, it sounds like a wake-up call, like catching something early on
Exactly.
when you have a better chance of changing its course.
And that brings us to the impact of diabetes. It's not just about elevated blood sugar. It's about the potential long-term damage to various organs. The NIDDK states that uncontrolled diabetes can affect your eyes, your kidneys, nerves, heart, and even increase the risk of certain cancers.
That's a scary thought. Can you give us an example of the kind of damage uncontrolled diabetes can inflict?
Sure, let's take the kidneys, for example. High blood sugar levels over time can damage the delicate filtering system of the kidneys, leading to a condition called diabetic nephropathy. This can eventually lead to kidney failure, requiring dialysis or even a transplant.
Wow, that really underscores the importance of effective management. So, how do we go about managing diabetes? What are the cornerstones of a good management plan?
Well, the NIDDK outlines a straightforward approach. They call it the Diabetes ABCs. This focuses on managing three key areas: A1C, blood pressure, and cholesterol.
Okay, so A1C, that's a blood test. That gives you an average of your blood sugar levels over the past 2 to 3 months. How often should someone with diabetes be getting their A1C checked?
That's a good question. The frequency of A1C testing depends on individual factors and their
Yeah.
doctor's recommendations, but typically it's done every 3 to 6 months. And
Yeah.
as for target ranges, those can vary, but generally an A1C below 7% is often the goal for many adults with diabetes.
So it's not just about a one-time check. It's
Yeah.
about ongoing monitoring to make sure those levels are within a healthy range.
Yeah, and what about blood pressure and cholesterol?
Right. High blood pressure and unhealthy cholesterol levels are major risk factors for heart disease, which is already a significant concern for people with diabetes. So keeping these in check is vital.
So what can someone do to actively manage these three areas: A1C, blood pressure, and cholesterol? I know medication is often part of the picture, but what about lifestyle changes?
Lifestyle changes are absolutely crucial. In fact, the American Diabetes Association heavily emphasizes their importance.
Yeah, and they have a whole section on their website dedicated to food and nutrition. I found it super helpful. They even have diabetic-friendly swaps for traditional recipes, which is great because I love to cook.
It's a treasure trove of information. They go into meal planning, portion control, making healthier food choices, all essential aspects of managing blood sugar levels through diet.
What I find interesting is they focus on understanding the glycemic index and choosing foods that don't cause drastic spikes in blood sugar. Absolutely. And beyond healthy eating. Regular physical activity is another cornerstone of diabetes management.
I know even moderate exercise can significantly impact blood sugar control. What are some specific types of physical activity that are good for people with diabetes?
That's a great question. Activities like brisk walking, swimming, cycling, or even dancing can be great choices. The key is to find something you enjoy and can stick with consistently.
Right. Consistency is key, and let's not forget about the importance of sleep.
You're right. Sufficient sleep plays a crucial role in regulating blood sugar levels and hormone balance.
It's like all these lifestyle factors work together to support overall health and diabetes management. And of course, if you smoke, quitting is paramount.
Absolutely. Smoking makes the health risks associated with diabetes even worse, so quitting is essential for overall well-being. Now, aside from those lifestyle changes, we shouldn't underestimate the emotional toll that managing diabetes can take.
That's a really good point. It's not just about the physical aspects. It's about the emotional and mental well-being of the individual. What are some of the emotional challenges people with diabetes might face?
Well, the constant monitoring, the
Right.
dietary restrictions, the fear of complications, it can all lead to stress, anxiety, and even feelings of burnout. The NIDDK emphasizes the importance of seeking support from mental health professionals or support groups if these feelings become overwhelming.
Yeah, absolutely. It's about acknowledging that this is a journey that requires a holistic approach. And speaking of support, building a strong healthcare team is crucial, right?
It's essential. Managing diabetes isn't a solo endeavor. Having a team of experts who can provide guidance and support can make a world of difference.
So who are the key players on this healthcare team?
Well, your primary care provider is your first point of contact. Then you might have a diabetes specialist, often an endocrinologist, who specializes in diabetes management. A registered dietitian can help you navigate the nutritional aspects of diabetes. And a certified diabetes educator can provide practical guidance on day-to-day management skills.
That's quite a team. And sometimes a social worker can also be helpful, especially when it comes to navigating resources, insurance, or even the emotional aspects of living with a chronic condition.
Absolutely. Social workers play a vital role in addressing the broader social and emotional needs of individuals with diabetes. Now, shifting gears a bit, we want to talk about something we've been working on that we believe can be a valuable tool in the diabetes management journey, our app, Sugar Notes.
Yes, we are so excited about this. We designed Sugar Notes with practicality and ease of use in mind.
One of its core features is a blood sugar log, allowing users to track their blood glucose levels effortlessly. We know consistent monitoring is key to understanding patterns and making informed decisions, and we wanted to make that process as simple as possible.
I think we've done that. It's designed to seamlessly integrate into your daily routine. No more bulky notebooks or complicated spreadsheets.
Exactly. And here's where it gets really interesting. We've also integrated a macronutrient calculator with a barcode scanner.
I love this feature. It makes tracking your macros so easy. Just scan the barcode of a food item, and the app calculates the macros for you using the Open Food Facts database.
It takes the guesswork out of managing your diet and helps you make more informed choices.
And to top it off, Sugar Notes generates visual reports and trends based on your data. It helps you see the bigger picture, how your diet, activity levels, and other factors influence your blood sugar.
It's all about empowering you with insights to take control of your health.
And this aligns perfectly with the spirit of Diabetes Awareness Month, which is all about raising awareness, education, and support for those affected by diabetes.
Speaking of Diabetes Awareness Month, it's a fantastic opportunity it really gives us a chance to amplify those critical messages.
It does.
It's a time to shine a spotlight on diabetes, educate the public, and advocate for better research and care and resources.
And there's so many ways to get involved. The American Diabetes Association, for example, they've got tons of information on their website about events and fundraisers and ways to spread awareness.
Yeah, even small actions can make a difference. Whether it's sharing accurate information with friends and family, participating in a local walkathon, or donating to diabetes research, every bit counts.
It's about creating that ripple effect of awareness and support. Now, I want to circle back to something you mentioned earlier about the emotional challenges of managing diabetes. We talked about the importance of seeking professional help. But are there other practical strategies that can help people cope with the emotional burden?
That's a great question. And yes, absolutely. One thing that can be incredibly helpful is connecting with others. who understand what you're going through. Even though our app Sugar Notes doesn't have a social component, we've heard from many users that simply having a tool that helps them feel more in control of their diabetes management has a positive impact on their emotional well-being.
That makes sense. Feeling empowered to manage your condition can definitely alleviate some of that stress and anxiety. And I think that's something we really focused on when designing Sugar Notes, creating a user-friendly and empowering tool.
Exactly. And beyond the app itself, there are other things people can do to manage the emotional side of diabetes. Practicing mindfulness, engaging in stress-reducing activities like yoga or meditation, even journaling can be really beneficial.
It's about finding healthy coping mechanisms
Mhm.
that work for you. And remembering that self-care is not selfish, it's essential.
Couldn't agree more. Now, before we wrap up our discussion, I want to bring it back to you, the listener. We've covered a lot of ground today, from the basics of diabetes to risk factors, management strategies, and even the emotional aspect. But what resonated with you the most?
Yeah, what stood out as particularly relevant or insightful? And more importantly, what's one small step you can take today to either prioritize your own health or support someone in your life who's living with diabetes?
It could be as simple as educating yourself further about diabetes, reaching out to a friend or family member who's been diagnosed, or making a conscious effort to incorporate more healthy habits into your own life.
Every little step counts.
Huh.
And remember, you're not alone on this journey. There's a wealth of information and support available.
We encourage you to check out the resources we've mentioned today, including the American Diabetes Association's website and, of course, our app, Sugar Notes.
You can find Sugar Notes on Google Play. We designed it to be your pocket-sized companion in diabetes management, making tracking and monitoring and understanding your data easier than ever.
We've poured our hearts into developing this app, and we truly believe it can make a positive impact on your diabetes journey.
So as we wrap up this deep dive, I think the message is clear. Knowledge is power. Understanding diabetes and taking proactive steps towards management can make a world of difference.
And never underestimate the power of small changes. Even seemingly insignificant adjustments to your lifestyle can have a cumulative positive effect over time.
It's all about progress, not perfection.
Well said.
So here's a final thought-provoking question to ponder. As you continue on your journey, what's one thing you could do differently tomorrow to better manage your diabetes or support someone you love who is living with this condition?
We hope this deep dive has provided you with valuable insights and a renewed sense of empowerment. Remember, with awareness, proactive management, and a supportive community, you can thrive despite the challenges diabetes may present.
Thank you for joining us. Stay curious, stay informed, and stay well.
And building on that idea of empowerment, I think it's important to remember that diabetes management isn't about deprivation or limitations. It's about making informed choices that support your well-being.
Yeah, that's a really good point. It's not about giving up everything you enjoy. It's about finding that balance that works for you.
Exactly. And with the advancements in diabetes research and technology, there's a lot to be optimistic about.
Oh, absolutely. We're constantly learning more about diabetes, developing new treatments,
Mhm.
and creating innovative tools like Sugar Notes to help people manage their condition.
Yeah. And that sense of hope is so important. It fuels continued progress and empowers people to live full and vibrant lives despite the challenges of diabetes.
Absolutely. So as we wrap up this deep dive into diabetes awareness and management, I want to leave you with this. We've explored the complexities of this condition, the risk factors, the impact it can have on your health, and the essential elements of a comprehensive management plan. But beyond all the information and strategies, remember this: you are not defined by diabetes.
That's a powerful message. It's a part of your life, but it doesn't have to control your life.
Exactly. And with the right knowledge, tools, and support, you can navigate this journey with confidence and resilience.
We hope this deep dive has given you valuable insights and empowered you to take ownership of your health. Remember, small changes can lead to significant improvements over time.
Thank you for joining us on this exploration of diabetes awareness and management. Stay curious, stay informed, and stay well.